How are communities across the state handling the COVID-19 crisis? What do they need to continue to operate shelters and services in their part of the state? With Zoom and an accomplished lineup of speakers, we want to highlight the work and partnerships that are occurring as we respond to COVID-19 across the state and the need for ongoing investments for programs and resources. This year, MCH has a bold agenda. We are advocating for $15 million in investment to strengthen the emergency services program that will empower communities across the state to find creative, flexible solutions that address homelessness in their Minnesota community. $50 million in shelter capital. This investment to expand and preserve temporary housing options like shelters for families and individuals experiencing homelessness and form pathways to hope and long-term housing stability. And third, the housing support program, investments to support and sustain quality, affordable housing costs that strengthen lives and communities. We know that these investments and policy changes are vital to advancing progress to end homelessness. Quite simply, shelter saves lives and housing ends homelessness. Our first speaker was slated to be the Lieutenant Governor Peggy Flanagan. However, she won't be able to join us this morning. She sends her regrets, but we are looking forward to hearing from her tomorrow, along with the governor at our program. So first, we will hear from a leader in Southeast Minnesota, from Rochester. Mayor Kim Norton has been the mayor of Rochester since 2019. Prior to her work at the city level, she served for 10 years in the state legislature and also served on the Rochester Public School Board. Welcome, Mayor Norton.
Thank you very much. It's just such an honor and a pleasure to be here with you today and speak on behalf of the need for homeless supports. 2 years ago, when I became mayor, we noticed a problem. I noticed a problem almost immediately, and I've been talking about it since. We had residents experiencing homelessness, setting up shop in our skyways, creating housing there, sleeping in cars and tents throughout the city. And I kind of set my mind to seeing what we could do locally about that. I will say, oddly enough, COVID has given us opportunities with the CARES Act funding to perhaps move a little faster. We did build an immediate partnership with our county and opened a warming center that could house some, but not all of our area homeless. But the CARES Act funding and state funding has allowed us to partner more broadly. So we partner, one of our strongest partners is our public library staff, Olmsted County, many of our local nonprofits. And we have been working to set up a system of supports throughout the community. And that looks like day centers, it looks like warming centers, but these are temporary. We don't have long-term solutions. We're using temporary buildings that have different purposes and will be torn down. We're using CARES Act funding that will end. And we really need a long-term solution, not just in Rochester, but across the state to really help those experiencing homelessness. So I would say to put a few numbers about what we have, our day center, which provides a place for our homeless population to go, even if they are given some temporary housing, to go during the day. We average in the city-supported day center 59 residents a day. A recent count of our homeless in town found 155 youth, or 155 adults and 40 youth experiencing an evening of homelessness, or I think it was a 3-day count, but that are chronically homeless. So we know this situation isn't going to go away. And in fact, given what's happened with COVID, will very likely get worse. So I am here to stand with you in support of the legislative asks to let the community, the legislature know that not only do we need funding for operations, but we need funding for shelter dollars. And those dollars can be used to support temporary housing until the county and others can move folks into a longer term supportive and permanent housing situation. So again, I'm happy to be with you here today. The needs are real and great, And I stand with you in finding solutions and asking the legislature to help us find solutions to support our residents that are experiencing homelessness. Thank you so much.
Thank you, Mayor Norton, for all that you're doing in Rochester to raise this issue up and being a partner in our advocacy work together. You know, as you pointed out, the pandemic has created a lot of hardships, but there are also really creative solutions and opportunities. And future investments could really create new or further opportunities across our state. So next up, we are going to hear from Carrie Johnson, the Service Area Director for Supportive Housing Programs and Care Coordination at Avivo. Carrie Johnson joined Avivo in 2014 as a supervisor for the Homeless Project and is here to talk about the Tiny Home Village. Welcome, Carrie.
Great, thanks for having me. I'm excited to be here and talk about a few initiatives that Avivo has been a part of here in 2020. So the increase of unsheltered homelessness due to the pandemic has really become a public health crisis, which I think is why all of us are here today. Last year, Avivo responded in two unique ways to address homelessness during COVID. The first one was like the Hotel to Home initiative, and the second one was Avivo Village. So I will talk a little bit about both of those initiatives today. So our Hotel to Home initiative is about moving entire micro communities or kind of large encampments into COVID-19 safe shelters with supports. So in this model, moving them into kind of their own hotel rooms that allows for, you know, the social distancing, those kind of things. The hotel model offers private rooms and facilities for individuals. In May, we started by responding to an urgency to move encampments of residents due to the pending riots for the murder of George Floyd. We were notified that there was going to be some riots in a certain neighborhood in South Minneapolis, and the safety of those residents were in jeopardy. So within 3 hours, yes, 3 hours, we gathered 70 individuals and their belongings. We put them on buses and moved them to a hotel in a safe area away from the riots. This was only made possible with the super quick response from the state, the county, nonprofit support, as well as funding through OEO. All of our residents were placed in permanent supportive housing or their next best placement within 90 days of moving into the hotel. So we did not exit people back to homelessness, but rather move them into permanent supportive housing within 90 days of moving into the hotel. In that environment, we provided 3 hot meals, access to on-site medical services. We had mental health supports on site, and other community support to help people take their next best steps, whatever that would be. In this model, partnership was crucial for this response. Avivo had a strong partnership with Red Lake Nation to help us provide the housing support, the long-term housing need. We partnered with Involve Minnesota to cater meals. And then we couldn't, again, do it without our funding and support from Hennepin County, the state, et cetera. We operated the hotel at least 2 other times one other time in 2020, and then just recently here in 2021. In August, we relocated an additional 80 individuals from an encampment near Franklin and Hiawatha in Minneapolis. And then we opened another Hotel to Home program again during the recent cold snap here in February, where we housed 36 individuals. The second initiative that Avivo is a part of is Avivo Village. And that is just another COVID-19 aware approach to kind of shelter and working to kind of end the homelessness crisis that we're facing. It just fully opened this week. So on Monday, we kind of opened our doors fully. And as many of you know, it is an indoor village of 10 tiny homes or dwellings located in the North Loop neighborhood, designed specifically to address the issues of unsheltered homelessness. We hope to serve anywhere from 250 to 300 individuals per year. And this example is probably the greatest one we have when we're talking about community partnerships and how coming together really helps kind of address this issue. In early of 2020, when this model was being developed, it was developed by housed and unhoused community members. as an alternative approach to shelter. It is a result of extensive work with community advocates, neighbors, elected city, county, and state agency and funders, social service agencies, and philanthropies. Philanthropist, sorry about that. Just a quick kind of rundown of it really quickly. Again, it's 100 homes. They are locked, so people do have that ability to lock their stuff behind. I think that's usually a concern of individuals in shelter. We have private bathrooms, private showers. There is 3 catered hot meals every day that arrive for breakfast, lunch, and dinner. We do have a very strict cleaning schedule to make sure that we maintain kind of the COVID safety. And then we also have wraparound services on site. So we have community health workers and housing workers, a medical team on site, mental health staff on site, etc. Again, Avivo Village is only possible because of the partnerships. White Earth Nation has helped inform the operations and the cultural responsiveness. Housing, our Simpson Housing has been a good partner in helping us launch this. We've worked with Sage Prairie for on-site medical services. We have our capital costs were funded again by city, county, state, through kind of CARES Act funds, and then also through generous donors. Avivo Village will be funded ongoing through housing support as well as some fee for service. However, it will need ongoing investment and support through charitable givings. So these are kind of the 2 examples I have of how Avivo has responded and the community has responded to the crisis, as well as kind of the pandemic, the health pandemic. So I'm just excited to be here and work with you guys to get some more funding and services.
Thank you, Carrie. Very exciting and inspiring innovations that are happening here in the metro area to address unsheltered homelessness, as you pointed out. You know, I'd like to point out like the nimble response that you guys had this past summer, and the partnerships that are so essential, both from public and private sources and all levels of government, including tribal nations. So thank you for reminding us what investments can do to address unsheltered homelessness. Next, we're going to hear from Stepping Stone Emergency Housing, the only shelter serving single adults in the suburban region of the metro area. We'll have Julie Jepsen, Executive Director, and Delicia McCain, Life Skills Advocate at Stepping Stone Emergency Housing, share with us today. Delicia helps residents build and strengthen essential skills for successfully living on their own, such as time management, hygiene, cleanliness, and other. Welcome, Julie and Delicia.
Thank you. So my name is Delicia, and I work for Stepping Stone, and I'm the life skills person there. I am a mother and that values family and advocating in homelessness, and I know what it's like to be homeless. So as I was asked to do this, I was thinking like, how can I put 8 years of continuous homelessness into 2 minutes? It's hard to say what part is more important than the other. How can I tell you about, you know, sleeping in a car, or being at work and my mom having to sleep in the airport, and sleeping in the car with my 1-year-old daughter and my mom? It's really hard to narrow things down and to say what was more important, because it was all important. It was all very real and very serious. We had to sleep in a church on chairs, pull them together with my daughter, my mom, and I. Because of a issue in the church, we end up having to leave out of the church and sleep in our car in South Minneapolis. And not being able to sleep, seeing my daughter sleep in the back seat, seeing my mom very uncomfortable in the passenger seat, me not being able to sleep because I'm worried about our safety, sleeping in the car in Minneapolis. There was a night where I got in my head and told myself that we couldn't do this any longer. It wasn't fair for my daughter to see us, even though she was one, didn't really understand, but knowing myself and seeing her in the situation wasn't fair to have her in this situation. So I got my mind together. I'm a person that does not like to ask for help, and knew that I needed help in this situation, and decided to ask a person that I trusted to help find us a place to live, whether it was shared housing, roommates, whatever the case may be. I had to, my experience humbled me enough to ask for help. And that's what I did. And we were able, about a month and a half later, we were able to find a place, and we're actually still living in that place right now. So it's been 3 years since we've been living in that place. I, out of all of this, I want my daughter to understand and to know that it's okay to struggle, it's okay to fail, it's okay to have doubt sometimes, but to never let it overcome you, and to never let it control you. And one day I just got the strength enough to look for housing, and we got a place. But even after having peace and finding a place, I still wasn't secure enough in myself, and didn't know what I wanted to do. Still felt kind of stuck in a place. And it wasn't until after I got the opportunity to work at Stepping Stone where I kind of found my footing, and I'm able to help other adults, other residents, excuse me, other residents be able to help them to be able to push themselves forward in the same situation that I was in. And it still gives me, to this day, I still struggle with certain things, but helping them helps me seeing how we can all help each other. And my experience was pre-pandemic, but now that we all kind of are struggling in a way, we all kind of can be sensitive to the fact of homelessness, and see that, we all are struggling in some type of way. But that's my story. Julie, you want to hop in?
Thanks so much, Delicia. Hi, everyone. I'm Julie Jepsen with Stepping Stone Emergency Housing. Thank you so much for inviting us and taking your time out of your morning today to talk about something that's so incredibly important to each and every one of our communities. So as Rhonda said, Stepping Stone is the only adult homeless shelter in the 5 counties of Anoka, Washington, Dakota, Scott, and Carver counties, the 5 counties surrounding Hennepin and Ramsey. So over the years, we have visibly seen an increase in those who are experiencing homelessness through panhandling, through people sleeping in their cars, in public spaces. But what's really scary is the number of people experiencing homeless that we don't see every day. And those numbers are dramatically increasing, especially in these past 12 months. It shined as a huge spotlight on the issue of those experiencing homelessness. And COVID has forced all of us to look at these individuals right in the eye. State, county, and local agencies and organizations came together like never before with much needed money and resources. We saw our community become more and more generous than ever before. And while all that was happening, what was also happening was that our waiting list grew and grew and grew. At one point, we had almost 450 human beings on our waiting list. We know that shelter programs like Stepping Stone will not put an end to the massive crisis that is homelessness, but we also know that is one vital component to giving help to those who need it the most. One immediate solution to the growing need of shelter this past year was the repurposing of hotels. This has literally saved lives, but was once an urgent solution. We realized that it cannot be a long-term remedy. It's going to end. It needs to end, and there's 2 very specific reasons why. One, Providing real necessary help to individuals who are living in isolation behind a closed door is very, very difficult and oftentimes impossible. All of us need community. All of us need a support system, especially those who are experiencing homelessness, struggling with sobriety, and working through mental health issues. They need the support of a community more than ever. And secondly, it is not financially sustainable. Stepping Stone has 66 clients that we serve daily. 33 or half of those residents moved to a hotel on April 2020. For one person, for 1 month, it cost the state $2,100. That is not a solution, and that is not sustainable or feasible in the long run. So what is the answer? COVID has shown that homelessness and those experiencing it must be prioritized, and in order to move forward, we must invest. Not give handouts, but invest in established, responsible, proven nonprofit leaders with innovative, affordable solutions to the vital need that is shelter. We, along with those who have lived experience, come to the table with realistic and attainable answers to the vastly complex issues that is homelessness. Thank you so much for inviting Delicia and I this morning, and happy to take any questions if you want to send them through the Q&A.
Thank you, Julie and Delicia, for sharing your perspective from the suburban area of the state and what you have done during COVID-19 and just the power of investments to make a difference in communities and how smart investments are truly needed to continue to advance our work collectively across the state. Next up, we'll hear from Partners for Housing in South Central Minnesota. They'll share about their essential creativity in navigating this pandemic and what they could do with increased investments. I'd like to welcome Jen Thieneman, Executive Directors of Partners for Housing, and Melissa Carlson to share their experiences now. Welcome.
Hi, I'm Melissa, and I'm a single parent, and I have a job, and I've been advocating with Partners for Housing and MCH, and I'm here today to share a small portion of my story on homelessness. When I became homeless, I entered a relationship that was a toxic relationship, and I lost my job, and I lost my home, and from losing my home, I had to send my 2 kids with my mom because it wasn't right for them to be homeless with me. I wanted them to have a better life than me. And then I came pregnant, and I was in my early 40s, and I was a high-risk pregnancy. I developed the pregnancy diabetes, and I had really swollen ankles because I couldn't rest appropriately because I was homeless. I couldn't rest. And I doctored out of town because I was scared that child services would take my child after it was born, because you can't have a baby when you're homeless. It's just not right, not here in our country. And I delivered the baby, and couple months after I delivered the baby, somebody told me about Partners, and they said that they'll take you in, and they won't take your baby away. They'll take you and your family. And I was like, oh, great. And I reached out to Partners, and they put me on a waiting list, and I got accepted into their shelter, and it was amazing. They took me underneath their wing. It gave me hope. It gave me a lot of hope. And they got me an apartment, and after I got settled into the apartment, they helped me get furniture, and my family came back from the lottery. It was great. It felt like it was too good to be true. And after I got settled in, I ended my toxic relationship, and I went to Express, a job service, and I said, I need a job ASAP, and they got me a job. I got my son in daycare, and I started working, and I'm doing it all by myself. There's nobody there to stop me. And I I got stuck. But I've been living there for 3 years now, and my older daughters are doing awesome. One is married and has her own home and working her career. And my other daughter, she has a baby of her own and is engaged and has her own place. And thanks to COVID during quarantine, I registered to go to school for social work to get a degree. And my son will be starting kindergarten next year. And I want to thank you. And I want to say thank you for listening to me today. And I hope that others can learn that homelessness can happen to anyone. Thank you.
Thanks, Melissa, for sharing your story. As always, you are such a strong advocate for people that have experienced homelessness, and your positivity shows that you can really get past that. Our organization actually has been blessed to work with Melissa twice. She's now in our long-term housing program as well, and just doing amazing. So it's just proof that with the right mindset and help, a real big difference can be made in the lives of people that are struggling. So as was shared, I'm Jen Thieneman, and I'm the Executive Director for Partners for Housing. And so I appreciate the opportunity to share a little bit more about our organization. So every day our organization receives desperate calls from people who are homeless or at significant risk of becoming homeless. This includes singles and families. In fact, 46% of those that we serve are children under the age of 18. Every day our shelters in Mankato and St. Peter have no immediate space available, and we can only add people to our waiting list. The challenges of homelessness are consistent year after year, and obviously during COVID-19 have increased the hurdles people face and the need for our team to fill the gaps, including taking advantage of CARES Act funding to add hotel vouchers to our programs. Regularly, I'm asked why we don't buy this property or that, or an empty big box store to develop some kind of housing and serve more people. The answer is that we just don't have the money as a nonprofit. We will leverage opportunities, however, such as a motel that was gifted to us by a private donor in 2018. A year and a half later, and through the patchwork of 6 competitive grants, we've now had the funding to staff and pay for utilities to be able to offer 14 additional sleeping rooms. We are currently remodeling at our shelters in Mankato and St. Peter through grant dollars and volunteer help to address facility issues and create more space. The margin of error, however, is really slim, and uncovering unexpected issues taps our reserves. However, we still need dollars to replace 2 roofs, 2 parking lots, a security system, exterior lighting, windows, and much more. Imagine how much more effective we could be in serving people when we aren't dealing with a crumbling ceiling that will shut down our kitchen, laundry, and bathroom like we're dealing with this week. Shelters that are appropriately designed, equipped, and staffed can make a significant impact when there is appropriate funding to support the nonprofits running them. This equates to capital funding to expand or build new, renovate to address maintenance issues, or increase the number of beds. This is certainly the case for our organization. We would welcome the opportunity to serve more people. However, we are geographically landlocked and working with buildings that are 75 to 110 years old. This is the difficult journey for the nonprofits whose grants are not guaranteed year after year and the investment in facilities is not available. The state must devote significant funding now during COVID and beyond to make this happen, and it should happen. People living in areas not meant for human habitation or in unsafe situations is not okay. At Partners, we've been working tirelessly for 36 years to protect our most vulnerable guests and provide the resources for our staff to do this critical work. A commitment to fund shelter operations and expansion for the long term is an investment not only for our outstate nonprofit working to uphold the southern region, but also for our partners across the state, as well as the health and well-being of our communities. Thank you for your time.
Thank you, Melissa and Jen. I want to say a special thank you to both Delicia and Melissa for sharing your personal stories. It's not always easy to do that. Investment in shelter operations funding through the ESP program. So our next guest is Kendall Benson from Catholic Charities of St. Paul in Minneapolis, who is here to talk with us about the housing support program. As a program manager of their scattered site housing support program, Kendall's team helps approximately 200 eligible housing support participants find and maintain affordable, stable housing with private market landlords throughout the Twin Cities. Welcome, Kendall.
Good morning, all, and thank you for having me. Our scattered site housing support program at Catholic Charities works with eligible housing support recipients to find and maintain affordable, stable housing with private market landlords. All 200 clients that my team currently supports in community-based rental units have a disabling condition and experienced long-term homelessness. Thanks to housing support dollars, they all now have housing through individual leases with private market landlords throughout the Twin Cities. Monthly housing support payments help these tenants cover basic housing costs, rent to landlords and utilities first, with added flexibility to cover common necessities like transportation, bed and linens, and cleaning supplies. Housing support has changed the lives of our clients in their journey of obtaining and maintaining housing stability, but it is getting harder and harder for our program to meet these needs. We're facing two challenges. First, housing support has not kept up with the cost of rent and the additional supports required and expected of this program. More often than not, we are looking at rents that are beyond the housing support base rate, not including utilities. This leaves our program with limited to no financial resources to provide clients with other necessities. Additionally, we are spending nearly as much time relocating existing clients to more affordable housing units than we are helping new clients move into housing. Secondly, limits placed by housing support on resident absences is also problematic. Currently, a person cannot be gone more than 18 days at a time without losing their benefit. For individuals with chronic illnesses, mental illness, or substance use, it means they have to choose between entering a needed treatment program and giving up their apartment key or not tending to their health needs. Our clients are being forced to choose between their health or their housing, but what we know is that housing is healthcare. The legislation helps address those challenges. We know that housing support is a unique public-private partnership that has worked to prevent homelessness and move people into stable housing, but the current rate is just not sufficient anymore. The extra $100 a month provided by House File 601 and Senate File 319 would make it easier for more private market landlords to say yes when my team calls to ask about a potential unit for a client. That means more tenants could stay in their current units and have a little extra to help cover those basic costs that many take for granted. It also means my team could become more efficient, gaining more time to help new clients by reducing the amount of moves we do throughout the year. The change to the absence policy offered by the bill also means a person could get the healthcare treatment they need to be able to return home after completing treatment instead of returning to homelessness. These are common sense updates that will support the longevity of housing support programs. These changes will increase our overall efficiency and allow us to better meet program expectations, create more opportunity for program landlord partnerships, and support housing stability for more Minnesotans. Thank you.
Thank you, Kendall, for highlighting just how powerful the housing supports program can be in not only serving people who are transitioning from homelessness to permanent housing, but also infusing those resources into the private market as well. Next, I will introduce Jordan May, who is the Executive Director of the Red Lake Homeless Shelter. Welcome, Jordan.
Good morning, everyone. Hi. Yeah, this like Rhonda said, I'm Jordan May, Executive Director of Relay Homeless Shelter. I apologize for being late to the meeting. I was taking care of an incident that happened directly inside my family shelter, so that's why I was a little late. And I'm just kind of getting back to everybody now. So. Just a few little things that kind of go over to what kind of homelessness looks like in our area. Obviously, on the the Red Lake Reservation, there is just a big lack of housing stock, and we typically have anywhere from 800 to 1,000 people that are doubled up or homeless and meet the actual literal definition of people staying outside and everything like that. So it's kind of a big issue, and it's brought up a lot of different attention issues for our actual tribal leaders, our tribal council, and community leaders. Due to all the barriers and the issues that COVID-19 has brought due to extra stress with mental health issues, chemical dependency issues, and certain barriers that people are going through. It helped kind of shine a light on the actual homeless issues that are in our area. So people, became more compassionate to the needs of everybody that is going through this pandemic, especially pertaining to homelessness. So, it actually kind of brought up a lot of different issues that people were having. So obviously, like with us at the Red Lake Homeless Shelter, we provide emergency shelter, a lot of it, several wraparound services and things like that. But it helped kind of, spark creativity in different programs, so we can actually communicate and collaborate and coordinate a lot of different services. And that's another thing I was doing this morning. I just kind of got some deliveries because hopefully next week or the week after, I'm going to be opening up a brand new single adult shelter. I'm going to be helping with 12 beds. And the nice thing about that is it has different wraparound services right next to the exact shelter. So we're going to be providing a lot of different group talking circles and different things. So everything's going to be culturally specific, and it's really helping bring a holistic approach to homelessness issues that people are having. So it really helped get our tribal council leaders involved and kind of connecting those government meetings, things that we actually need in order to to help serve everyone around our community. And I know Red Lake has actually been able to utilize some of the ESP funds because I know Carrie Johnson was one that actually helped me develop my my hotel to home project, and we actually developed the housing support services, and we've been able to transition people from homelessness to the hotel to their own permanent housing. And I believe so far we've served around 18, I think, that have their own permanent housing. Whereas, if we didn't, have any of this COVID fund and none of these resources, what, would have been available for the people in our area, so it's been a lot of different, things happening, so rapidly and fast. It has brought a lot of different positive aspects of changes and responses. We've actually made so many different community connections with resources that I didn't even know in our area. So it's really helped develop a lot of different community connections, and people just really kind of doing referrals and relying on one another to absolutely provide these necessary services for everybody in our area. So yeah, it's been a lot of work, and I'm just thankful for all the connections and the resources that have been available in order to serve the people.
Thank you, Jordan. And your work continues to inspire, of course, all of us. And I think highlighting that low barrier and culturally specific programming that you've been able to create and sustain over the pandemic is really important for us to think about, and the need on why investments in shelter capital and the emergency services program are so vital to sustaining your work. So thank you. As I wrap up today, I want to thank each of our speakers who have shared here today on what they're doing in their area of the state to find solutions to ending homelessness. Even before the pandemic emerged, about 20,000 children, adults, and seniors across the state were homeless. During this pandemic, organizations across the state have shown incredible tenacity to provide life-saving services and have continued to innovate and find creative solutions to bring people inside during the pandemic. You've heard a sampling of that important work today, but that doesn't come without a price tag. We know shelter saves lives and housing ends homelessness. I do call on our legislative leaders to make investments in the programs and shelter infrastructure needed to continue the progress made during the pandemic and to make investments needed to create housing stability for every Minnesotan. And now I'm going to pass it over to Kirsten to facilitate questions from the media.
Hello, everyone. This is a reminder, if you are with the press, to put press in front of your name so we can promote you to panelist. I see a few of you, so we're going to go ahead and promote you now. And then you can ask some questions, and panelists, as you are able to answer them, you can either raise your hand or just unmute yourself and answer the questions. So it looks like we have a few media being promoted right now. And again, attendees, if you do have questions, you can utilize that Q&A feature or the chat feature. While we're waiting for questions, are there any pieces that people want to mention one more time to really hit it home?
I'll just jump in here and say I added some comments over in the side. I didn't talk a lot about the use during the pandemic of our Mayo Civic Center, our convention center, as a temporary spot. I did talk about temporary, and we have moved our homeless populations to several different places throughout the pandemic in order to offer better and safer services to get vaccinations and testing during the pandemic of our homeless populations. But the need for something permanent and reliable, a place for people to go to get the support they need. And so our county, frankly, knows where to find people that need the services, because when everyone is dispersed throughout the community, how can anyone find them to offer what is available? So I think the day center also serves, or opportunity center, whatever we want to call it, offers that access point for county and nonprofit services that is so needed in the communities. And I'm hearing some of these other wonderful providers talk about being able to offer those supports. And we're really lacking that down here in Southeast Minnesota.
Thank you, Mayor Norton. It looks like we have a couple different questions in the chat, so I'm going to read one of those, and if anybody is able to answer that, that would be great. What types of support or community services, funding on funding are provided and or needed for homeless youth and or homeless families in regards to education or digital learning?
I was hoping that maybe one of the shelter providers who provide services to families could talk a little bit about some of the ways they're navigating distance learning during the pandemic. I have heard from other providers that they, worked really hard to try to figure out Wi-Fi and internet for those families, and also trying to find tablets or PCs for the students in their programs.
Hi, Rhonda, this is Jordan. Maybe I could, touch on that a little bit. I know up here on the Indian reservation, the kids are just now finally starting to get back into school. But then that was one thing that was really hard on all families, and especially with families, that are homeless. So we tried to kind of work with the school in order to make sure that the kids had the tablets, and then to try and see how our staff could coordinate to help some of the families, during times when they had the actual distance learning. And it was a learning curve, but I'm kind of glad that we were able to figure it out. And then some of the kids were able to interact with some of their other classmates that they haven't been able to see during the pandemic. So yeah, I mean, it was something that was kind of cool, but difficult to figure out at the same time. So, but yeah, it's kind of something that we're kind of getting more into, so we can figure out how to provide different telehealth services and things like that.
Thanks, Jordan. Any other response to that one? Otherwise, I have a couple other ones. I'll go ahead and read this next one. What, if any, parts of these new approaches and connections will be retained after COVID passes?
Well, I will just speak for my community. I know the relationships that we have built throughout the pandemic are strong. Our library staff have done a lot of the staffing of our homeless shelters, our day centers. And those relationships were there before, frankly, because many of our homeless used our library as a safe place to go during the day where they were treated respectfully. And so it was kind of a natural next step for the staff of the library. They man our call center, and then they also staff our call center and also staff our day center. And they are committed to this work, as well as a brand new nonprofit that had started up 2 years ago called The Landing locally, working with the Salvation Army, Dorothy Day, those providers are committed to their work, and we are committed to continuing to work with them in order to provide the kind of care we need for every member of our community. So while the funding may go, I'm hoping we can find some replacement so those relationships can stay strong to help solve the issues that we're grappling with.
Anyone else want to tackle that one? Okay, here's another one. I think we have time for about 2 more. So here's one more. Why are we not asking for funding for permanent affordable housing? Shelter is critical, but do we need housing to get moved into as well?
I'm happy to tackle that one. So in a typical bonding year, this is a budget year. In a typical bonding year, we, and this would be Commissioner Ho's line, go big so everyone can go home. We always advocate for big investments in permanent housing. That we know that shelter or housing is a solution to homelessness. But right now we also have a huge gap in the shelter system. And so in order to bring people inside and prevent people from dying outside, we do need that piece of the housing continuum to be able to help people transition from being unhoused and unsheltered in the community into that safe space, and then working with folks to get them into housing. There's sometimes a lot of barriers, and I think probably some other providers could talk about some of the things that they do to help people get into housing, but sometimes there's documents that are needed or other challenges that the person may have until that they need that time in the shelter in order to get into permanent housing. So it's not an either or question from our perspective. We need both.
Thank you, Rhonda. Does anybody else want to tackle that one as well? Okay, here's another one. How do we get more support for the wraparound services? It might be a service provider that would be able to answer that one.
I'm not a service provider, but I can say one of the things that we're really looking forward to in the city of Rochester is the funding that came several years ago from the legislature for mental health supports. We have a facility that will be opening soon. And we know that for some members of our homeless population and other members of our community, that crisis center, that mental health crisis center will be very necessary. And one of the other partnerships that we've started locally is working with our emergency medical team. They actually stepped forward and asked to partner with us to help provide services so that when they get a call and there may be a mental health or chemical dependency crisis going on in the community that might involve a member of our homeless population, that rather than having the law enforcement folks be the first one to intervene and handle it through a law enforcement solution, that it can be handled through a medical solution. And we're hoping that that'll be beneficial.
Kirsten, I'd like to tackle that one a little bit, if I could. So we haven't seen an increase of need in support of wraparound services. The wraparound services that we utilize, mental health, chemical dependency services, things like that, are available to us. And it's just really establishing those partnerships and making sure those partnerships are very strong and actually really work with our residents and provide strong resources for them. The issue that we're dealing with now, that we are all very much looking forward to going away with COVID, is the possibility of telehealth. Unfortunately, telehealth for those residents who are living in the shelter is not as effective as we once had thought. Having a resident face-to-face with a service provider is so essential right now, because they're missing that human interaction. They're missing that connection that an individual has with a service provider, with a therapist, with someone who can really help them, that the barrier of a computer screen or a tablet screen is really, really hard to overcome. So from my perspective, it's not necessarily financial support, but the physical support in opening our doors once COVID passes, if it actually fully passes, but we get to a safe spot where people feel comfortable coming into the shelter.
Thanks, Julie. I have another question here. Are there any efforts to redo or reform the GRH funding? $9.34 a month is not helpful in the metro area, particularly for larger families, even if MFIP is included.
So that is actually one of the key pieces of our advocacy agenda this year. It's the third piece around housing supports. GRH is actually, I believe, and maybe I'll ask Zack, our public policy director, to chime in on this too, but it's now called the Housing Support Program, and we are advocating for increases to that program because it not only provides that housing piece to get people into permanent housing, but it provides those wraparound services that are to families. Zack, do you want to chime in a little bit on that?
Yeah, I would love to. Hey, folks, this is Zack, Acting Director of Public Policy with the Minnesota Coalition for the Homeless. Thanks all of you for joining. So GRH is the name that it used to be known by, but because not everybody on these programs lives in a group residential setting, some people live in individualized settings. A while back, the name was switched to Housing Supports, which is on our legislative agenda. And what we're advocating for, as Rhonda said, is a $100 increase to the base rate for that program, provides that room and board for folks in those settings. And it is really critical for folks who are in the metro, but also in greater Minnesota, that we get these dollars. In a lot of greater Minnesota counties, for instance, utilities can be really expensive. We've heard from folks in places like Clay County, which is the Moorhead area, that room and board rate would be so critical for being able to keep people in that stable housing because of the utility cost, not necessarily the rent. So it is absolutely a critical piece of our legislative agenda, and we are trying to make sure that it is sustainable as we move forward into the future.
Thanks, Zach. Carrie or Kendall, if you have anything you would want to add to that as it relates to housing supports, you could chime in too.
You guys summed it up perfectly. Thank you.
Yeah, I definitely would not add anything to that other than we could definitely use an increase. Just like Kendall's team, we spend a lot of time just rehousing people in a more affordable unit versus working on housing people for the first time into housing. So just second what Kendall to say.
Great. Well, those were the questions that we had. Rhonda, I'll let you wrap this up. And thank you all for participating in this press conference and our first day of virtual Homeless Day on the Hill.
Well, thank you all for being here. Obviously, this press conference really was able to focus on all the creative solutions that communities across the state are putting forth, and we need investments from the programs that we're advocating for to be able to sustain those into the future. So I would encourage you not only to come to the program tomorrow for Homeless Day on the Hill, but advocate and reach out to your legislator. Check out our website for a toolkit and how you can advocate. Thank you all.